Good day, everyone. I'm your host, John Mark Ilagi, for today's webinar called Contraception, A Choice and Knowledge. Today is all about sex education, how we can prevent them, and uh, how we can discuss each and every one of them. So I hope for your passionate engagement and collaboration. By the way, this webinar requires your full involvement. But before we start, may I call all of the speakers of this webinar? Please introduce yourselves.
Hello everyone, I am Chari Labrador.
Hello everyone, I'm Margaret Lodripas.
Hello everyone, I am Francine Lucas.
Hello everyone, and I am Salve Maka.
Okay, and thank you. Okay, next slide, please. For our agendas naman. Yan, first, we'll be talking about sexually transmitted infections, yan, together with sexually transmitted disease. Yeah, next one is, third one is the teenage pregnancy. Then next is the family planning. Then lastly is the solution or the cure and prevention. Yeah. Okay, next.
So we will discuss about sexually transmitted infections and sexually transmitted diseases. So sexually transmitted diseases, STDs, or sexually transmitted infections, STIs, are most commonly spread through sexual contact. Bacteria, viruses, and parasites that cause sexually transmitted illnesses can spread from person to person through blood, sperm, vaginal fluid, and other body fluids. So ano nga ba ang pinagkakaiba ng sexually transmitted infection and sexually transmitted diseases? So sexually transmitted disease, STD, first begin as sexually transmitted infections. Note that not all diseases begin with infections, but many do. So infection occurs with the sexually So how does it happen? Infection occurs with the sexually transmitted bacteria or virus first enters the body and begins multiplying. Once the sexually transmitted bacteria or viruses have entered the body, the infection may progress into a disease. So here we can see the most common sexually transmitted infections and diseases. On the left side, we have the curable and mostly bacterial STDs and infections. So the currently curable are syphilis, gonorrhea, chlamydia, trichomoniasis, and on the right side, we have the incurable or for life, which are mostly viral. These are hepatitis B, herpes simplex virus, HSV, also known as herpes, HIV, and human papillomavirus or HPV. So the first one is the syphilis, which is an STI. These are the most common symptoms. So as we can see, there are rashes on the skin, most commonly on the soles of the feet and on the palms of the hands. Pero pwede din natin siyang makita on the neck, dun sa hair area, the face area, and the most common body parts. So, dito makikita natin kung anong itsura niya in person. So, we have the palms of the hands and the sole of the feet. On the lower right side, we have the earlier stages of syphilis, and on the upper left side, we have the later stages of syphilis, which is ulcer-like lesions. Next, we have the ulcer-like lesions on the anus area of a woman and near the vagina of the woman. Next, we have yung ulcer-like sores on the mouth area. Ganito po yung itsura niya on the tongue, on the outside and inside of the mouth area. So next would be gonorrhea, which is a common STD. So on the lower left side, ito po yung tinatawag nating tulo. And then we can see that there are purplish blotches on the skin, common on the feet and on the hands. Next one would be chlamydia. So, yung chlamydia po, hindi po siya masyadong nakikita sa mga lalaki. But the symptoms could be may sumasakit na yung ari ng lalaki or nilalagnat na sila. Chlamydia is most common in women. So we have chlamydia discharge here, and then chlamydia eye infection, which could be irritating. We can notice redness here, and it could be itchy. And then the next symptom is chlamydia throat infection. So symptom nito is swollen throat. And then we have the hepatitis B, which is an STD. So these are the symptoms of hepatitis B, with losing your appetite, jaundice or pangingilaw, fever, dark urine or pale poop, nausea and vomiting, pain in the right side of the abdomen, joint pain, hives, headache, weakness or fatigue. And then we have herpes or herpes simplex virus. So for herpes, meron tayong HSV1 or oral herpes, which is nakikita sa oral area of the mouth, oral area or the mouth. And then we have HSV2, which is genital herpes. So on the lower left side picture, we can see the earlier stages of herpes blisters or later stages of herpes blisters. So pwede natin siyang makita sa genital area. And then, the next we have human immunodeficiency virus or HIV. So for HIV naman, it will start as an STI for stage 1 acute HIV infection. So the symptoms are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. So next, magiging chronic na siya. So stage 2 is clinical latency or chronic HIV infection. And then, sa stage 3, doon na natin makikita na magiging STD na siya, magiging disease na siya. So, magiging acquired immunodeficiency syndrome na siya or AIDS. Symptoms nito are rapid weight loss, recurring fever or profuse night sweats, extreme unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids. Pwede din tayo magkaroon ng memory loss, depression, and other neurological disorders sa AIDS. And then, the most common STI is human papillomavirus, also known as HPV. HPV does not usually cause any symptoms. Most people who have it do not realize and do not have any problems. But sometimes the virus can cause painless growths or lumps around your vagina, penis, or anus, also called as genital warts. So, hindi lang to sa HPV but mostly sa mga STI, hindi talaga nakikita or hindi siya nagpapakita ng symptoms. Kaya minsan, usually kung ganon, hindi napacheck agad yung mga STI, magiging STD na siya. So, dun lang nila nalalaman pag AIDS na yung meron sila. Next presenter, please.
Okay, so we have teenage pregnancy. So next slide, please. Teenage pregnancy usually refers to pregnant teenagers between the ages of 15 to 19 years old, but there are some cases wherein girls as young as 10 years old gets pregnant. One of the symptoms of teenage pregnancy is missing one or more menstrual periods. So, meron kasing mga girls na merong irregular menstrual cycle. So, if you are sexually active, mas better if magpapacheck sa OB-GYN to know if yung cause ba ng hindi mo pagkakaroon is dahil irregular ka or positive ka na sa pregnancy. Other symptoms are the following: nausea or vomiting, also called morning sickness. So this can occur throughout the day. Next is sudden cravings for certain foods such as meat, fatty or fried foods, and fruits. Pwede rin silang mag-crave sa fast foods or junk foods. Next is sore breast, unusual fatigue, frequent urination, unusual mood swings, and weight gain. They can also experience lower back pain, crying, constipation, bloating, and headaches and dizziness. Next slide, please. Okay po. Next, we have the teenage pregnancy risk. First is lack of prenatal care. Next is risk of having high blood pressure. Next is premature birth. So this happens when a baby is born too early, usually before 37 weeks of pregnancy. This usually happens if a woman gone through multiple pregnancies and experiences infections or chronic conditions such as diabetes and high blood pressure. Moreover, this can also happen because of drug or alcohol abuse. Next, we have STDs. Next is risk of having baby blues. So, yung baby blues po usually happen sa mga new moms. So, sila yung mga nakaka-experience nito. So, they experience mood swings, anxiety, sadness, irritability, appetite problems, troubles in sleeping, tapos hindi rin sila ganong makapag-concentrate. Next, we have the postpartum depression. This may be mistaken as baby blues, pero mapapansin mo na yung symptoms nito is intense and can last longer than baby blues. So, na may eventually interfere sa pag-alaga mo sa baby or other daily tasks. Symptoms of postpartum depression usually develop within the first few weeks after giving birth, pero it may occur earlier during pregnancy or a year after birth. Signs and symptoms of postpartum depression may include severe mood swings, excessive crying, difficulty bonding with your baby, loss of appetite or eating much more than usual, risk of having insomnia or sleeping too much, overwhelming fatigue or loss of energy, intense irritability and anger, the feeling of being not a good mother to your baby, feelings of worthlessness, shame, and guilt, severe anxiety and panic attacks, and lastly is thoughts of harming yourself or your baby. Next, we have the postpartum psychosis. So, this is a rare condition that typically develops within the first week after delivery. This may lead to life-threatening thoughts or behaviors and may require psychological treatment. So, usually, yung mga symptoms ito is same lang sa postpartum depression pero mas severe. So, ito yung mga symptoms ng postpartum depression na may similarities rin sa postpartum psychosis.
So now for the postpartum depression solution, it generally includes therapy with a mental health professional such as psychiatrist or psychologist. Another standard treatment method used in conjunction with therapy is the prescription medications like antidepressants. Example of this is the Sanor, pampatulog. Postpartum depression recovery should also include healthy lifestyle practices like getting enough rest, staying hydrated, maintaining a healthy diet, avoiding alcohol and cigarettes, staying physically active through activities like walking or swimming or any exercises. So, next slide, please. How do teenage pregnancies affect babies? Early mothers are more likely the primary source to give birth to premature babies. Sometimes these babies lack complete development in their bodies and brains, leading to lifelong difficulties. Premature babies also tend to be underweight and have trouble breathing and feeding as infants. As a result, underweight babies are more susceptible to diabetes and heart disease, leading to higher risk of infant mortality. Next slide, please. Now, for the teenage pregnancy prevention and solution, the only way to be sure not to get pregnant is actually not to have sexual intercourse. However, there are many methods to reduce the chances of becoming pregnant when an individual is sexually active, and the first one is the use of male condom. Male condoms are small, thin pouches made of latex, plastic such as polyurethane, nitrile, or polyisoprene, or lambskin that cover a man's penis and collect the semen. Next are the birth control pills and birth control shot. The birth control shot is a hormonal injection that prevents unplanned pregnancy for 3 months at a time. The hormone in this shot is called progestin and works similarly to the birth control pill. It prevents ovulation and increases the mucus buildup around the opening of the cervix. Next is the intrauterine device, or also called IUD. It is a small T-shaped plastic and copper device that's put into the uterus or the womb and releases copper to stop pregnancy, and it can prevent fertility for 5 to 10 years. Last one is the birth control implant, aka the Nexplanon. It is a matchstick-sized progestin-releasing rod that's inserted under the skin of your upper arm, preventing pregnancy up to 4 years. So, these contraceptives are the ones easily accessible here in the Philippines. But there are still lots of options to choose from, like the cervical cups, birth control patches, female condoms, contraceptive sponges, and vaginal rings. To be effective, any method of these contraceptions must be used consistently and correctly. Other methods and programs can also be done, such as the sterilization, which is the permanent method of birth control. Examples include tubal ligation for women and the vasectomy for men. Others are fertility awareness, comprehensive sex education, youth development and service learning programs, as well as the abstinence approach. Thank you.
And moving on to teenage pregnancy. Next, we have here family planning. Okay. Next, basically, family planning is having the desired number of children. Yan, when you want to have them by using safe and effective modern methods, yun yung tinatawag nilang contraceptives, yan, such as condoms, yan, birth control shots, and the yan, such as pills, yan. And in addition, now we have this called proper birth spacing, which is having children 3 to 5 years apart, which is best for the health of the mother, and especially her child and the family. Okay, next is the solution, and which will be discussed by Miss Margaret Rodriguez.
So, this Likhaan Center for Women's Health, one of the organizations that provide contraception as well as STI and HIV testing. This non-profit organization was established in 1995 and since then has provided women with a wide range of contraceptives such as birth control pills, condoms, injectables, implants, IUDs, and more. In addition to sexually transmitted infection and HIV counseling, screening, and testing. Some of their clinics offer cervical screening, prenatal care, and birthing services. Likhaan offers these services for free and with absolute confidentiality, making contraception and reproductive health care accessible to Filipino women. They have clinics in Quezon City, Pasay, Nabotas, Manila, Bulacan, and Eastern Samar. Their location in San Jose del Monte, Bulacan requires clients to request an appointment in advance, while the rest accept walk-ins and operate on a first-come, first-served basis. Um, Another non-profit organization is the Love Yourself, founded by Dr. Ronnie Bean Garcia Pagtakhan. It is one of the leading organizations in HIV awareness, testing, and treatment in the Philippines. It aims to raise awareness of sexual health, HIV, STI, mental health, and SOGI through social media platforms. They also have an app called Safe Spaces PH that allows people to get access to free condoms. Without embarrassment and judgment, safe spaces can be anywhere which access to free condoms without which can determine by looking for the Safe Spaces logo or using the app to locate the closest one in your area. Similar to Likhaan, they offer these services for free and they have clinics in Mandaluyong, Manila, Cebu City, Parañaque, Cavite, and Caloocan. For now, they require their clients to schedule an appointment before going to the clinic.
Okay, so before moving on, so another STI, STD, teenage pregnancy and family planning solution is condoms from convenience stores and pharmacies. And then we recommend to get yourself tested. Isa pa, as you test yourself, dapat tinatanong mo din yung partner mo um, or the person whom you will have sexual contact with to get an STI or STD test. So it is important to practice safe sex and educate ourselves about STI and STD. So overall, STI and STD is a disease which might require ongoing management for many years. It is important to practice safe sex and educate ourselves about STI and STD. Safer sex doesn't mean there's no chance of acquiring STDs, but if you're going to engage in sexual behaviors with another person, it is important that we both practice safe sex and get tested regularly for STI and STDs to reduce risk. So, ayun nga po, ang pinaka-recommended po is contraceptives like condoms. Kasi yung condoms po, yung body fluids po natin, hindi po nakakalabas through, hindi po nakakalabas either sa man or women. So, that's it for the solutions. Next, we will have the questions and answers from our Twitter.
Now, before we start, these are the questions we gathered the day before delivering this webinar, using hashtag people ask and be safe reports using the Twitter app. Yeah. So, the first question will be, what is the difference between STIs and STDs? STIs are sexually transmitted infections, while STDs are sexually transmitted diseases. And STI is only considered a disease when it causes symptoms and it became yeah, later on it will later on become a disease na. Okay. Next. And can you get STDs or STIs from kissing? And only cer- only certain STDs or sexually transmitted infections are ayun, transmittable through kissing. One of its examples are yun, the herpes simplex virus or the HSV and the cytomegalovirus or the CMV. Yun. Kissing can be uh, one of the most exciting parts of a relationship, but you may also feel worry of kissing if you're with someone for the first time. Yeah. Next, can an STI be cured? STIs are very common naman, no? And all STIs are treatable. Yan, many are completed. I mean, many are completely curable. Even STIs that are not curable can be treated, and the symptoms managed can be through medicines. Yan, viruses such as HIV, genital herpes human, uh, papilloma virus, or the HPV. Those are the non-curable or incurable. Those are viral infections na yan. Panghabang buhay na siya. Panghabang buhay mong dadalhin yan, hanggang sa or yan, immune system hanggang sa mawasak yun. Okay. What is the main reason of teenage pregnancy? The main reason of teenage pregnancy and in some cultures and customs and traditions uh, leads to early marriage. No? Meron, I mean, meron tayong tradition. I mean, for Muslims, di ko lang sure yan. They are exposed. I mean, they are sagrado daw sa kanila yung arranged marriage, and some of the victims are mga bata pa, yan, teenage. Yan, in these cases, pregnancy is acceptable and is most often intentional, since yun, mag-asawa na sila, no? However, they are in some countries, yan, in some developing countries such as India and sub-Saharan Africa, and teenage pregnancy is most often unintentional. Okay, next, what are the effects of teenage pregnancy? Okay, what are the what are the effects of teenage pregnancy? Yan, teens are often forced to become reliant on their family. Siyempre, mga bata pa tayo, wala pa tayong masyadong wala tayong pinagkukunan ng income, no? Wala tayong source of income, since yan, we are nag-aaral pa lang tayo. Yan. And in some cases, teens are ashamed by their parents and do not even receive any support. And with that, no, naghihirap yung mga batang maaga nagbubuntis, yan. And these young girls are often forced to find a job early. So, with that age. Okay, next. Who is at risk for teenage pregnancy? Mga teenage ages to 13. Simula, pwede na mabuntis sa ata. How do we prevent teenage pregnancy? Okay. How do we prevent? Through contraceptives, no, we can prevent teenage pregnancy. Next. What are the effects of family planning? And why is family planning important? No? And so what are the benefits naman of having family planning? And family planning makes us improve maternal health and child survival since ayun nasa tamang edad na yung mga nagbubuntis if ever na ayun mag-family plan sila. And it will reduce the number of abortions overall, especially unsafe abortion, and as well preventing sexually transmitted infections such as STIs, yan, including HIV and AIDS. Yun yung mga one of the dangerous one kasi yun, hindi na siya na-cure. And in addition, it will likely benefit the whole country since we are promoting social and economic development. And what are the benefits of on the other hand naman, what are the disadvantage no, of having that of not having a family planning? So the disadvantage will be yan, teenage pregnancy will rapidly increase as well the unwanted pregnancy and without contraceptions, STIs and other diseases will continue to spread. Yeah, that would be all for the question and answer. And that is all for our webinar in contraception and knowledge.